I'm being treated for breast cancer right now. I've been diagnosed with stage 2 ductal carcinoma in one of my breasts, and it has moved also into the lymph nodes. My mom died of breast cancer at 50, and she had it for approximately 3 years, and it moved through the system. And she died in the 1980s.
We follow women that are high risk for breast cancer, family history, gene positive patients. We do follow them, and we link them with the Ontario Breast Screening Program, high risk program now. People are often overwhelmed at that time. They know there's something wrong. Some patients will ask directly, do you think this could be cancer? But every woman who has anything in their breast is worried about breast cancer.
Dr. Arnaud could have been my best friend when I first met her. She's soft-spoken, she's caring, she looked right at you, and she treated you with such dignity. Made sure that the curtains were closed, and just had an aura about her that was so calm that you felt at ease with her no matter what.
I've been doing breast surgery for a number of years now and treating breast cancer patients, and I've realized that a lot of the women come to tell me that it's not actually the treatment that's the really bad part. It's actually the waiting leading up to the treatment, and a lot of women have told me that that part is actually even worse than the surgery or worse than the chemotherapy. And so that really started to make me think, is there something I can do to help reduce the wait times? The Rapid Access Diagnostic and Support Program, or the RADS program, is a new, innovative service delivery model that we've adopted for our patients at the Ottawa Hospital who have a high degree of suspicion of breast cancer. And we started because of the frustration with the prolonged wait times that the patients are going through to get to their diagnosis. We started out by doing some research on what our current wait times were 2 years ago, and we noticed that they were surprisingly long. They were 52 days for the average patient in that category to get to the diagnostic stage. And so we felt that there was something that we needed to do at that point, and that it was an unacceptably long wait time. We did map out all of the steps along the processes of a diagnostic journey. So what every patient would have to go through in order to get to the point where they have a diagnosis and they're ready for treatment. And once we eliminated all of the inefficiencies along all of the steps, we found that we could significantly and dramatically reduce the entire wait time for the patient leading up to the diagnosis. And we've been able to do that successfully, reducing the wait times from 52 days down to 7 days. And that's a huge improvement for the patient. So we're quite proud of that. We've also been able to assign a nurse navigator to the patient, and that nurse navigator contacts the patient the minute they come in with an abnormal mammogram, and then tracks the patient and efficiently moves the patient through the system so that they get the next available appointment, the fastest appointment possible, and so that they can get the fastest pathology results possible as well. Kathy is one of my patients that went through the Rapid Access Diagnostic and Support Program, and she was able to get her diagnosis within a matter of days. And it wasn't until I actually met her as her treating surgeon that I found out that she was a nurse. So she's somebody who really understands the healthcare process and is quite pleased that we've been able to do this for her as a patient.
My journey is absolutely gone 360 degrees from what my mother went through. I know all the results of my tests immediately. They are listening to everything that I have said in terms of diagnosing things. Right off the bat, they are ruling out all kinds of areas where the cancer had spread. They have given me definitive treatment options, and I'm looking at like a great diagnosis, really. To be honest, it looks like I'm not going to die, whereas my mother was left hanging all the time. She could be my doctor any day. She can be. I hope she's my doctor for my girls, if something ever happens to them. So.